My name is Augusto Bastidas, and today we are going to be discussing on what's new in total knee replacement. We're pleased to have Dr. Terry Delaney from Los Gatos, California. Dr. Delaney is an orthopedic surgeon in private practice with a specialty in joint replacement and sports medicine. He was fellowship trained at Stanford University. Welcome, Dr. Delaney.
Thanks, Dr. Bastidas. How are you?
I'm well, thank you. So I understand joint replacement, particularly knees, is becoming a bigger and bigger issue as the population ages.
It is. Knee replacement surgery is really one of the great success stories in reconstructive orthopedic surgery. It's been around for about 40 years. And very few operations in the orthopedic armamentarium are as successful in their ability to both relieve pain and restore function in people with knee arthritis. And
what exactly do you mean by neoarthritis? What are the reasons for needing a joint replacement?
Well, what arthritis is a condition where the cartilage in the knee has been worn away or lost over the course of time, maybe due to trauma, an injury, an infection, any number of reasons. When the cartilage of the knee is lost, the ability of the knee to act as a smooth hinge or joint is lost. And that results in several things. The most common complaint is pain. The second most common would be loss of function or motion. Up until the advent of knee replacement surgery, there wasn't much that could be done to effectively relieve pain or improve function other than the use of a cane or pain medications. With the advent of modern joint replacement surgery, we've had an opportunity to really provide a service to these individuals that have got tremendous benefits that are very predictable.
Is the pain from the physical rubbing of worn out cartilage? Is that where it comes from?
What's due to when the cartilage is lost, the friction between the bone ends rubbing against each other are very, very irritating, and that results in fluid buildup in the joint and irritation of other structures in the knee. In the long term, this results in deformity of the joint and weakness of muscles and ligaments, which can then lead to other problems elsewhere in the body. So it's really a very complicated process that takes years to develop.
So for the viewers today, could you just briefly remind us what the different parts of the knee are, and then maybe you can tell us about how knees have been replaced in the past.
Okay. Well, the knee is basically, there are actually three bones in the knee joint. There's the thigh bone or the femur. And I actually have a model of one right here. And then the tibia or shin bone, which will articulate with the end of the thigh bone. There's a third joint that often gets short shrift here. That's the kneecap. The back of the kneecap or the patella rubs against the thigh bone as well. When any of these joints lose cartilage, you'll develop a symptomatic arthritic condition, and that, again, leads to pain and loss of function. Now, what's very topical today, the aging of the population, the baby boomers, so unfortunately I think we qualify. As the population ages, more and more people are going to require knee replacements. Presently, there are about 400,000 of these are done in the United States every year. And it's been estimated that by the year 2040, this number will at least double. It's an operation that's relatively costly. And again, this is going to obviously exponentially increase the cost burden to our healthcare system as time goes forward.
So the cost is not only just the operation, but complications, pre- and post-operative care?
Correct. The hospitalization time, time off work, time it takes to recover from the operation, and then complications that occur, or not even complications, just maintenance within the hospital. The need for transfusions, the need for antibiotics, the need for pain medication in the hospital. There are many, many factors that lead to the cost of any operation, but particularly so in major reconstructive surgeries like knee and hip replacement surgeries.
So currently when a patient presents to your office with pain and there's evidence that the joint has undergone significant degeneration, what does the patient expect? What are the steps in getting their knee replaced?
Well, first question, we want to assess what the patient's main concern is. Most people come in complaining of pain. Obviously, some people with painful conditions can be treated with less radical options in surgery or conservative measures. Sometimes weight loss, sometimes a well-directed physical therapy program can assist. The use of pain medications, over-the-counter anti-inflammatories like Advil are fantastic often. Cortisone injections. There are medications called visco supplementation. These medications you inject in the joint to help increase or decrease the friction in the joint. And these are just a number of conservative measures. If a patient has undergone a reasonable course of conservative care and they still have pain or loss of function that are keeping them from doing the things they like, that's affecting their lifestyle, that's when you consider knee replacement surgery. And that patients a course of conservative care may last for weeks or even months. But I tell my patients, you'll know when it's ready for a knee replacement. You'll know when you've failed conservative course of care. And that's when we consider knee replacement surgery.
And so is a knee replacement an outpatient surgical procedure?
Unfortunately, it's not. It's a major reconstructive operation. A typical hospital stay will be maybe 2 to 4 days, depending on someone's age, their medical condition, and their special needs. How debilitated were they before surgery? What is their home situation? But the bottom line is it's not an outpatient procedure, and it requires a hospitalization of several days.
Now, before we go into the information on the newer techniques, I understand you wanted to show us what a basic knee replacement is like and what the problems are with it.
Well, first of all, the operation itself is very well refined, but there is always room for improvement in any operation. Presently, with a knee replacement, the implant itself is designed to fit on the end of the patient's native femur. What happens right now is you've got a set number of implants. And what you do is you try to cut the bone to fit the implant. You're making the patient fit this implant. And that requires the use of some specialized jigs and bone cuts to help shape the bone. In particular, when you do the operation, you've got to obviously make an incision and open the knee. And when you make your bone cuts, you need some sort of an anatomic landmark to base your cuts. And what we use today is something called the intramedullary rod. And this is actual implant. These are stuff from the OR. You'll actually take a Makita like this, although it's medical grade Makita, and actually drill a hole into the end of the thigh bone. And then you'll take something called the intramedullary rod. This is a steel rod that will go into the thigh bone. The thigh bone's hollow. It's filled with bone marrow and blood. And this rod goes into the femur. And based on this, you've got these devices called cutting blocks, which we'll try to use to cut the bone precisely. But you'll notice that this intramedullary rod is not fixed in there. There's room for error. You can put the rod in maybe a little too much of an angle or a little poorly rotated, and if you aren't precise, the bone cuts will not be perfectly accurate. What's important to know is once the knee is in there, excuse me, and someone starts using the knee, just daily activities like climbing stairs, getting out of a bed, getting off a toilet, trying to play sports. If you multiply this over the course of weeks and months and years, there may be millions and millions of cycles in this joint. And that can lead to, over the course of time, loosening of the joint or wear and tear in the joint. And that can lead to pain and decrease the life expectancy of this implant. And once this implant, if it fails,